And now I just want to introduce the last of our four guest speakers. Stroke is the third most significant cause of early death in this country, and it is the principal cause of adult disability. The Stroke Association provide over 220 NHS-funded projects to support people who have had a stroke across the country. They have over 420 stroke clubs across the country. For the last 10 years, the Stroke Association have been the major funders of research into stroke. And I know for some 7 years now I've been chair of the all-party parliamentary group on stroke. And in that time I've been privileged to work with the Stroke Association in bringing awareness of stroke and of what we can now do to prevent stroke, to treat it more rapidly, to help those who have had a stroke through rehabilitation. And working with the Stroke Association, I have been tremendously impressed by everything that they have been doing and continue to do. So would you join me in offering a warm welcome to John Barrick, who is Chief Executive of the Stroke Association. John.
Good afternoon, conference. Thank you very much for inviting the Stroke Association here. A stroke can hit anybody of any age at any time and drastically changes lives. 1 minute everything is normal, the next, with the blood supply cut off to your brain, you may lose your power of speech, of sight, of swallowing, be paralysed, be incontinent, and facing the rest of your life with severe disabilities. As Andrew said, stroke is the nation's #1 cause of long-term severe disability. It's the #3 killer, and it costs us all over the country £7.5 billion every year. Around 1 million people are living after having had a stroke, and around 150,000 people have a stroke each year. This is devastating for them, their families, their employers, and for all who care for them. So what is being done about this? Until recently, while great strides were being made around services such as heart disease and cancer, little was being done to improve stroke. Indeed, there had been years of neglect, leaving the UK with some of the worst outcomes for stroke in Europe. Yet, the evidence is clear. If people are treated on a specialist stroke unit, their chances of dying go down by as much as 25%, and their chances of going home sooner are also better. If stroke was always treated as an emergency, then as many as 30,000 people a year could benefit from clot-busting treatments, a dramatic intervention that dissolves the clot in the brain that is the cause of most strokes. This treatment can make a dramatic difference, with people leaving hospital in days or weeks rather than months. With more and better support in the community, stroke survivors and their families can be helped to have a life after stroke. Helped to get back into work, helped to avoid family and relationship breakups, helped to avoid institutional care, helped to regain communication and mobility skills to become less dependent on others. The Stroke Association, together with many of the stroke professionals' organisations, campaigned for a long while for the creation of a new national stroke strategy in England, and December 2007 this was agreed. And new strategies are also now there in Wales, Northern Ireland and Scotland. I want to personally thank Andrew Lansley for the major part he has played in working for better stroke services. As chair of the all-party parliamentary group on stroke, he has been tireless in being a champion for cross-party support on stroke care. Now we are beginning to see good progress. Services are getting better, and of course, so are the people who access those services. Across the country, we now have a stroke research network, and in England, stroke modernisation networks are working on improving all parts of the stroke care pathway. You will have seen the stroke advertising campaign FAST, which is dramatically increasing public awareness of stroke. Ambulance services are now working on delivering stroke patients fast to the hospitals where people can receive the scans that will enable them to receive the appropriate treatments. And we are seeing the quality of care in stroke units rising. This progress has been possible because the stroke strategies came with extra money to kickstart their implementation. £105 million was invested in stroke. This is tiny compared to the overall NHS budget, but it only runs until 2011. This investment provides the basis for savings and improvements in stroke care costs longer term. There is a burden of responsibility on an incoming government to continue investment in stroke services. Health and social care must be seen together. Investment in stroke care in the community enables discharge from hospital and creates less dependency in the longer term. With factors that drive stroke on the rise, obesity, the ageing of the population, excess alcohol consumption, prevention of stroke is vital. Treating minor strokes or uneven heartbeats could prevent 15,000 strokes a year. Controlling high blood pressure could reduce the number of strokes in the UK here by 40%. Dozens of you in your local authorities will have led the commissioning of Stroke Association and other stroke care services in the community. These services are now providing huge support to stroke survivors and their families across the nation. We expect the National Audit Office report soon to be published to indicate that the investments in stroke are delivering excellent value for money for the taxpayer. And in these difficult financial times, it is reassuring to know that investment in stroke care makes financial and humanitarian sense. My plea to you, the Conservative Party, is that you commit to completing the work commenced on stroke care. The prize is a glittering one. Stroke is the #1 cause of long-term severe disabilities. The next government can take decisive steps to prevent stroke, reduce death rates, and help families be less dependent. Quite simply, with the support of everybody who's involved with stroke care, we can make a fundamental difference. Thank you, and very best wishes from the Stroke Association.
John, thank you very much.